Bonjour et bienvenue à chacun d'entre vous.
Hello and welcome to everyone. Will be speaking the Premier of Quebec, Mr. Francois Legault, the Minister of Health and Social Services, Christian Dubé, and the National Director of Public Health, Dr. Horacio Arruda. Mr. Legault, the mic is yours. Yes, hello, thank you, and hello, everyone. So with Dr. Arruda and the Minister for Health, we spent at least 2 hours last night together with experts from the INSPQ and the INES and Public Health to look at the data very closely, region by region. And, well, listen, good news. The measures are functioning and the situation is improving. So the situation is improving with the lowering in the number of cases and in certain cases a plateau or even a lowering in the number of hospitalizations. So, of course, this makes us optimistic, but prudently so. We are really finishing up with this tunnel, but we have to be very careful not to be hit by a train on the way out. So yes, we will be announcing today a few slackening of measures, but it really has to be done gradually, particularly when we look at what is happening elsewhere. You can see it in Ontario, for example. As of yesterday, they were at 3,265 cases, whereas we had 899. In Ontario, they are at 2,336 hospitalizations. We are at 677. So we can see that things can explode very quickly and no need to go far in order to see that. And there are links between Quebec and Ontario, so we have to be extremely prudent in how things will follow. I'm going to go region by region, starting by the 3 regions that continue concerning us the most. First, the region where things are most difficult is the Outaouais. In the Outaouais region, yes, there's been a lowering in the caseload, but when we look at the rate of tests that come back positive, there is an improvement. We went from 10.5% to 8.5%. It has to be understood that the average in Quebec is now 2.9. So the Outaouais is at 8.5. That is truly the region where the numbers are the highest. So already we had a hospital network that was functioning very tightly, and we really have reached the limit in the number of beds that had been allotted to COVID patients. So there are patients who were transferred in the Laurentians. So there really is no leeway whatsoever in the Outaouais region, and that is why in the Outaouais region I'm announcing that we're going to be prolonging the emergency measures for an additional week. So from the 3rd of May to now the 9th of May. In the Chaudière-Appalaches region, the rate of positivity has improved. We went from 7.5% to 6.6% in the course of the past week. However, it has to be understood that the cases, or a great part of the cases, are concentrated in Beauce and the Lac-Etchemin area. So it's very difficult for hospitals in that area. We have been forced to transfer patients to Sherbrooke and Rimouski, so there really is no room left in the hospital system in both Lac-Etchemin. Of course, there's a region right next to it, Capitale Nationale, where we have a lot of hospitals and where the situation is improving significantly. In the national capital area in the course of the past week, the positivity rate has gone from 6 to 4.2%. So I'd like to take advantage of this to really give my warmest thanks to all citizens of the national capital who have certainly made efforts in the past few weeks, and it does give us results. There are still a few beds available, not many, but what is encouraging is that when we ask our experts to have a look at the projections for the following 2 to 3 weeks, they plan that in Quebec the number of hospitalizations should be decreasing over the next weeks. So I'm announcing that we are going to allow ourselves to open primary schools. As of next Monday, so that is the 3rd of May, in all service centers of the National Capital Area, as well as Chaudière-Appalaches, except schools of the Beauce Service Center and the Bellechasse municipality, which are in the Décolline Service Center, but that are also very affected. And why are we doing this? In Beauce et Lac-Etchemin, well, because there's a lot of community transmission and there is no leeway whatsoever in the hospital system left. However, in both regions, National Capital Area and Chaudière-Appalaches, we're going to be keeping the other measures. That is to say, high schools, unfortunately, are going to remain closed. We're going to keep the curfew at 8 p.m., and we are going to be keeping non-essential stores closed. So we are really going gradually by opening only primary schools. Now, for Montreal and Laval, the expected explosion has still not arrived, so our measures are functioning very well. The positivity rate in Montreal has gone from 3.8% to 3%, and in Laval it went from 3.4% down to 2.9%. So we can really see that, first, the situation has improved, is now at a much lower level. Moreover, there is leeway in the hospitals. The doctors who are responsible for that, Christian asked them the question many times, and what they're saying is, yes, there is leeway. And on top of that, the experts from the INES and the INSPQ are expecting that over the next few weeks, the number of hospitalizations will continue going down in Montreal and Laval. So what I'm announcing is that as of next Monday, the 3rd of May, in Montreal and in Laval, we are going to bring the curfew from 8 p.m. back up to 9:30 p.m. I think that will make many people happy. For the other regions, we can say that the situation is under control for the time being, and I repeat, for the time being, because we can't say it enough. With the variants, we have to be very prudent. There is no region that is safe from an explosion of cases. During that time, of course, what helps us is that we continue with the vaccination process. Things are going very well on that front. As of this morning, the people who have a physical handicap or a disability and their caretakers can get vaccinated. But I would like to give a message to people with disability and their caregivers. We haven't seen a lot of people register this morning, and I want to say that soon the Minister for Health is going to open up vaccination to all Quebecers. So it's important, if you want to be able to get ahead of the others, and I think that it's normal that people with a disability and their caregivers go in front of others. And it's the same thing as of tomorrow for pregnant women. It's important to register and get an appointment quickly before we open up vaccination at large. And maybe one subject that I've heard about quite a bit for the past few days, amongst others, certain unions and Quebec Solidaire asking us to give 4 hours of paid leave to all employees to get vaccinated. Well, first, it's important to say that it's not like an election that takes place only in one day. In all regions, there are places where you can get vaccinated in the evening, over the weekend. We have sent the message as well to the ministry and to all networks to be flexible, to be accommodating, and I am making a call out as well to all private employers. Please be flexible and accommodate your employees. But there are certain sectors where things are more difficult. For example, teachers. Everybody knows in Quebec that we have a lack of teachers, so it's not easy to find a teacher to replace a teacher. So that's why I say that we have to be flexible. So I think that if we all work together in good faith, it will be possible to continue giving the services that I would call essential while making sure that everybody does get vaccinated. And of course, there's been a lot of questions on what is coming up over the next few weeks or months. When are we going to open what? What are we going to have the right to do? And I look forward to it as well. The Minister for Health looks forward to it. And we are, together with Financial Health, we are we're setting up a sequence. We probably won't be able to give you dates for each element in the sequence, but I think that we can have a look, and that is what we're looking at. We're looking at examples where there are high vaccination rates, for example, in Israel, in the United Kingdom, to use that as a model and to be able to answer as much as possible to what is coming up. Of course, our system is going to be set up first and is going to remain in place, so the zones are going to go from red to orange and orange to yellow and yellow to green. But beyond that, are we going to be able to go see a show? Are we going to be able to go see a festival? Are we going to be able to get together? How many people? How many people are we going to be able to get together in the month of June and all that? I understand that people would like to have an indication. The easy answer is that it's too early to say so, but we are insisting to be able to have a sequence. So I would like to end by saying we are winning the fight against this third wave. We have the three winning conditions, I could say, that are brought together. First, the heat. We know that the virus doesn't like heat, and we can expect that over the next few weeks it'll be warmer and warmer. And we're also getting to the end of the school year, so universities and then CEGEPs and then primary and secondary schools, and vaccination is going well. We are at 33%. We are second in Canada, right after Saskatchewan. We have a higher rate like bigger provinces like Ontario, British Columbia, and Alberta, so it's going well. But we do not have the kind of community immunity that would be necessary to really, truly be able to open things up. So we are very confident. The Minister for Health is very confident that we'll reach our objective of 75% of eligible people will be vaccinated by the 27th of June. And just to give you an idea, we are going to start the summer 2021 in much better shape than the summer 2020 because of vaccination. So there is reason to be optimistic. We are getting to the end of the tunnel. And once again, I wish to thank all Quebecers who have made efforts during this entire year. We have to continue being prudent for a few weeks. This is not the time to get hit by the train, as I was saying, while leaving this tunnel. So we still have, some part of the tunnel left to drive through, but we'll soon get to our destination. Thank you so much.
Our experts tell us that we can be optimistic, but we also need to be careful. We're getting out of the tunnel, but the train of the third wave will hit us if we don't progress gradually. In Outaouais, the situation is improving, but it remains critical. Our hospitals are at the limit of COVID patients. That's why I'm announcing that we'll keep the same restrictions until May 9. In the Quebec region, it's getting better in certain areas, but the problem is now concentrated in Beauce and Lac-Etchemin. That is why I'm announcing that we'll reopen primary schools on May 3rd, with the exception of Beauce, Lac-Etchemin, and a part of Bellechasse. We'll keep the other restrictions until May 9. In the Montreal region, the restrictions are working. The number of hospitalizations is expected to decrease in the coming weeks, so I'm announcing that the curfew will now be at 9:30 p.m. in Montreal and Laval starting next Monday. Elsewhere in Quebec, the situation is under control for the moment, but we have to stay very careful. We must continue to resist the third wave as we continue vaccination. If we continue like this, we should have a great summer. We still have a few weeks of caution ahead of us, but we'll soon reach our destination. Thank you.
Merci. Oui.
Maintenant, passer la parole au docteur.
I will now hand the mic over to Dr. Arruda, who has some news to give. Well, listen, you all noted, as I did, the harm that this virus can bring us with deaths and complications, and we know that the virus itself can bring about thrombosis and all sorts of complications in the blood system, like embolism. It's clear that the virus kills, it's clear that it makes people ill, and it's clear that the vaccination is a protection, of course, against that. But sometimes, unfortunately, there are complications that are very serious, and we had told you that there were cases of thrombosis associated with the AstraZeneca Covishield vaccine. And it's with a lot of sadness that I wish to announce to you that we just had our first patient who has died of a thrombosis, a cerebral thrombosis following vaccination from AstraZeneca. I would like to present my sincerest condolences and sympathies to the family. This is an event that is rare. We know that it might happen. We have a risk of about 1 in every 100,000 doses. To date, it is the first death, I think the first death that has been declared in Canada, to my knowledge. This is a phenomenon that is expected, but you have to understand that the risk of catching the disease makes it that the vaccination still remains an element. We have, of course, put a limit of 45 years of age for that vaccine. So right now, I mean, this is very sad, this news. And once again, my sincerest condolences to the family, because when people get vaccinated, it's not to be ill. But in this case, it had this consequence. The AstraZeneca Covishield vaccination is going to be saving a lot of lives, but in this particular case, it brought sadness. So I wanted to share that with you in all transparency. And you have to know, we just got the confirmation not even an hour ago from the Hamilton lab that is confirming the antibodies that are created and that created a problem leading to thrombosis. Thank you, Dr. Arruda. We're now going to start the question period with François Carabin from Micro. Hello, gentlemen. I'm going to piggyback on that. Mr. Arruda, I would like to ask you, and perhaps Mr. Dubuc can also answer, what will that change, if it changes anything at all, to your distribution strategy as far as the AstraZeneca vaccine is concerned, that particular case? Well, if you allow me, I believe that right now it doesn't change anything, because we also have to see that there's been over many doses that have been given in England, for example, with cases of thrombosis that were at that level, so 1 out of 100,000. So we were expecting something like that. It is unfortunate, and despite the treatment that was given in this case, it didn't work. There's other kinds of thromboses that are treated and evolve very well once treated. We are here in a balance of risk. We're weighing things out. The diseases also brings about these complications. So for the time being, it also goes with the perspective of the reason why in Quebec we've decided to lower the age only to 45 and to not go lower for the time being in the context of our epidemiology. Had we had a lot more cases in Quebec, we could have gone lower up till 30 years of age like other provinces. For the time being, it should not change our strategy. And perhaps Mr. Carabin would say that, first of all, I believe that we're all in the same place, that is offering our condolences to the family. That's the first thing. We knew, and I think that when we're telling people to make that decision, knowing the risk, we know that serious complications come 1 out of 100,000, and we have to know that up until now we have had over 400,000 people vaccinated with AstraZeneca, and with this, I think there were 4 other cases being examined. So we are exactly, unfortunately, in the average, but we have managed to vaccinate 400,000 people who have fewer chances of getting COVID. So it's very sad, but it is something that we were expecting. And as far as we'll continue vaccinating, it is the kind of risk that unfortunately we have to take, but it's still the right thing to do. My second question is for Mr. Legault about the curfew in Montreal. It's been a few weeks now that it was brought back down to 8 p.m. What impact have you truly seen on transmission, you in Montreal and in Laval? And also, when can Quebecers expect to see the curfew disappear altogether? Well, first, people from public health, for having tortured them for 2 hours yesterday, last evening, me and the Minister for Health. It's always difficult to associate one measure with one specific result because there's a series of measures taken together. There's a situation that is different from one region to another. There's the presence of variants that is also different from one region to another, so specialists can never be truly, commit themselves directly on the impact of a specific measure. Now, the second part of your question goes with what I was saying earlier on, is that I also look forward to seeing what the next steps are going to be, in what order, and about when. We're working on that right now, together with public health, in order to get a sequence, even though probably over the next few days we won't be able to give you a specific date beside each sequence, but at least so that we know what's coming up and about when. Hello to all three of you. I have a question concerning the vaccination. So perhaps Mr. Dubé, on that, over the next few weeks, we'll start with mass vaccination. It's not the first time that we ask you the question, but it's the first time that we're so close to vaccinating people at large. So I'd like to know how it's going to work. Is it still by age group, or is it going to be first come, first serve on the Clic Santé site, or is it going to be walk-in clinics? Can you give a bit more information? I would love to give you a bit more information, but not today, because we are trying to finalize things. For me, what's important now is the last two groups, and the Premier mentioned it, but I'd like to make a reminder, whether it be for people with chronic illnesses or people with a disability that can get vaccinated this morning, and I'll be answering your question, but we have not had the rates of adherence to appointments that we were expecting. Maybe for two reasons. Maybe because it's only been a few days and we're following it on our websites on an hourly basis. I would like to make sure that people who perhaps had a harder time making a reservation for all sorts of reasons be able to have reservations. We've opened over 900,000 appointments for these two categories of people since last Thursday, and there's a lot of available appointments. So to be respectful towards that population that was waiting for a long time, I think we have to respect them and giving ourselves a few more days. Of course, we're not going to leave any vaccination on the shelf. So if ever those people, for whatever reason, have already been vaccinated in other groups, because this is a group that was not linked to age, you recall. So that's why I think that we want to take another few days. And that's why we're repeating today, if you are in those two categories, do not hesitate to go make an appointment. But that is also why we are talking to people in essential services and teachers and police officers. These are all people now who can make appointments. So, I look at the statistics, I see them every hour. There's still a lot of appointments for the entire month of May because it's 11,000 that we have added for the month of May. And maybe Thursday or Friday, because we're going to see one out of this week again, I would say that the trend that we've seen in appointments, I'll tell you, and if it becomes the right time to open up to the public, we'll see it with the Prime Minister's office. But I think that we're still waiting to see how the trend goes with those two groups, which for me are very important right now. I'd like to continue with vaccination. There's certain people who have been vaccinated for a long time. We start seeing the second doses. There seems to be sometimes a certain confusion on the behavior to adopt. So somebody who's been vaccinated, can they theoretically see their children if they have also been vaccinated? What are the rules to follow? Because there's certain people who are really looking forward to be able to see I quite understand. For the time being, we're recommending to bring no changes to the health measures because we can't always know who exactly has had what. We get vaccinated today, but it's going to take a few weeks before seeing the effect. And so I think that it's still a little early. I think that everybody, we can see people who get photographed after their vaccine. They're all happy. But let's be prudent. We have to follow the health measures, even if we've been vaccinated. When there's even more effects, like the Premier was saying, in the public, we'll be able to talk about those points. We're not going to delay. We've asked public health, and I would say that within a few days we'll be able to get back to you with much clearer positions on that. Hello to all three of you. If you could first confirm that the victim is a woman who is 54 from the Montérégie region, it would be appreciated. Also, my question, I'd like to ask you, Mr. Premier, because you deployed significant efforts to hire staff in CHSLDs, and you've just lost an employee who had denounced a situation that she judged to be unacceptable where she worked. What are you going to do for Ms. Labelle? I'm going to perhaps start by the lady who has died. You'll understand that for reasons of confidentiality, I don't want to be too specific, but I can tell you, yes, that it's a woman between 50 and 65 years of age. As far as the region is concerned, I don't think it's of public interest. It changes nothing that we be in one region or another. For epidemiological reasons and confidentiality, you will understand that I do not wish to answer that. Well, concerning the woman who was fired, it is concerning. We have given ourselves mechanisms so that whistleblowers be protected. So I have asked the Minister for Health to make a full investigation to see what happened. I'm sorry, I thought that you had something to add, but I just wanted to be sure. Are you also going to be searching through other employees' files, residents, people who talked about a problem? I understand that there's verification with a whistleblower, but basically the actual situation have you spoken to the people who spoke to the bosses before going to the media? Well, I was involved in the case. Remember, when I was at Treasury and there was a whistleblower in agriculture, I had been involved to reinsert that person. And what I remember very well, and that's what we'll do following the request of the Premier's office, is to make sure that the procedures, I would say on both sides, whether it be on the employee side or the employer side, that the procedures have been followed. And I'll explain. When an employee is conscious of something that they should mention, they are aware of the procedure to be followed. And the employer also knows this, so they should make sure that the network is available. So that is why I think that before making any comments, we've decided that even if it went up to the commissioner, my colleague Marguerite Blett went on the premises to check. I think that it is worth it, and I told the Premier to dig in the file, as we had done in the times of agriculture, and over the next few weeks, we are going to have a clearer idea of what it all means. I would like to hear you first on the eastern part of Quebec before going to another file. I would like to know the situation in eastern Quebec, to what extent it worries you, for example, in the lower St. Lawrence. I would also like to talk about the Côte-Nord. There are regions where, even if the cases are not many, as far as the ratio with the population, it's critical. Maybe Dr. Arruda can start on that. Well, it's clear that we are keeping a very close eye on the lower St. Lawrence and the Côte-Nord. We're in constant discussion with public health in both regions, and it seems that there particularly is on the western side of the lower St. Lawrence, there seem to be cases of community transmission at meetings. The Director of Public Health said that it worried him a great deal, that he wasn't necessarily ready to go in emergency measures, but if the situation were not to improve, that might be the next step. As far as the Côte-Nord is concerned, they are in an orange level right now. There are outbreaks associated to certain school areas in a particular zone around Bécomo. It's still under surveillance, and if ever the situation continues degrading or we don't see an inversion, we are going to act consequently. Mr. Legault, I'd like to hear you. On the Port of Montreal, we're now talking about a special law. This is what you would wish? Yes, absolutely. I had the opportunity of discussing about it a few weeks ago when I met in private with Justin Trudeau, and he had assured me that the federal government would act very quickly. With the year that we've just experienced, this is not time to hurt the economy, and it is not time either to send a signal that merchandise would be better sent from a U.S. port. Anyway, those people at the Montreal port make, on average, I think, $125,000 per year. So I believe that it's time that things get fixed, and I'm happy to see that the federal government is probably going to file a special bill to recall those people to work. Of course, if the situation follows the projections, if it continues like that, could we think that high school students are going to go back to school on the 10th of May? Well, as you know, the 10th of May is 2-3 weeks later. It's an eternity. We're going to go step by step. We really are going to go step by step. You know that as soon as we can allow students to have access to the best teaching approach, we do so. We do it in primary school because the impacts are much greater, and we have to see that in high school there have been approaches that have been developed, but we're going to see it, and we're going to do it always in collaboration with the Ministry of Education, which is able to see on the premises what the receptivity and the acceptability is by parents and school. It's a priority for me, and I never miss an opportunity of talking about it together with public health. I can confirm that. Mr. Dubé, do you have any idea of the proportion of teachers that are vaccinated and who are going back on the 3rd? On Monday? In proportion? No. We don't know. This is not data that is available for us by the Ministry of Education. Per work shift, you don't know? No. But once again, I'd like to repeat it for teachers because it is one of the groups for whom it would be difficult to give a 4-hour because we can't find any substitute teacher to replace them. So that is why I'd like to repeat it today, taking advantage of the fact that we're at the beginning of the opening of the 9,000 appointments, so that these, teachers be able to make appointments, because there's some available at every hour. I would invite them to make appointments. There was a lot of demand. I allow myself to go with that question. It's the entire question of pregnant women. We had asked Public Health to give us a notice today. This is something that they did this morning. So I think that this is another very good news that pregnant women have said in Quebec there's about 80,000 deaths per year, so maybe there are some women who have already been vaccinated, for example, healthcare workers, but it's close to 80,000 people who could be vaccinated if women decided to go. So let's take advantage of this opening of many appointment possibilities to go get them. And we will have to follow this in the next few days.
Bonjour, Monsieur le Premier ministre, Monsieur le ministre de la Santé, Dr. Arruda. Ma première question est pour vous.
My first question is for you, Mr. Legault. In the first, second wave, even the third, there were deaths, and you showed a lot of empathy. You were touched. We saw it by those deaths. In this particular case, the person who died following a vaccination, how do you feel about it? Do you have, I don't want it to be taken the wrong way, but do you have an impression of accountability in the sense that you are the ones who makes the decisions? So what does that make you feel, this first unfortunate death related to vaccination? Well, first, I'm very sad to know that a 54-year-old woman in good shape, I don't even know if I can say that, but died because she was vaccinated. It's very difficult to accept. At the same time, we knew we had experienced that elsewhere in the world where they said that there is a risk, 1 out of 100,000. Now it's a question of weighing out the inconveniences. Earlier I was saying we're opening up primary schools in Quebec. Well, it's a risk as well. It's possible that because we are opening primary schools in Quebec, that perhaps there are parents or grandparents that may be affected and who might die. But if we look at the inconveniences, if a child doesn't go to school for weeks on end, that's also a very bad thing. So we have to try to, weigh things out, see where there's the fewest inconveniences. And as Dr. Arruda was saying, if we vaccinated 400,000 people with AstraZeneca, those are 400,000 people who have much less risk to catch COVID and be hospitalized and dying. So in the balance of inconveniences, I continue thinking that it's a calculated risk. But of course, when we think of this woman, her family, her loved ones, first I offer all of my sympathies, and it's very hard. If you allow me, because I am responsible for the immunization program with my teams, it puts a face on a statistic, and for us, statistics are always people. And there's no way of knowing who the person is who's going to react that way, because if we could know ahead of time, we would not give the vaccine to that person. It really is a balance of risk, and it makes us very sad. I can tell you that my teams that have surveillance of side effects, when we hear these things, it touches us. And, we would love to be able to give a hug to the family. People don't get vaccinated to die. It's rare, and we can't predict it. But for Quebec at large and the population at large, the vaccination remains beneficial. My question more for Mr. Dubé. Last week, the federal public health said that in order to get to a certain level of normalcy or freedom, 75% of the population would have to be vaccinated. It seems we'll have reached that around the 24th of June, but also 20% of people who will have received a second dose. Do you think, first, do you agree with that analysis? And have we reached, or when will we have reached that level? That is to say, 75% plus 20% with the second dose. Well, on the question of whether it's the right thing to do, I'm going to let Dr. Arruda answer because he's the expert. What I would say, with the vaccination program that we have ongoing right now, 75% of the population, and we agree we publish it once a week, people 16 and over who are our admissible population, and we took 75% of that. That is what we committed ourselves to deliver for the 24th of June. Now, in the new statistics that we also put that we'd have 500,000 people with a second dose by the same date, who are mainly people from CHSLDs or PAs and healthcare employees. I prefer, rather than putting it in percentage of the population, I would prefer putting it in those three categories of people because it's them that we committed to respect, the 16 weeks. So for the time being, that's where we're at. I could supply you over the next few days. We could see how that is in terms of percentage of population. I like the numbers, but I would say that for the time being, what we're following is the 5.3 million for the first dose, which represents the 75%, and 500,000 of the second dose for the second date, which represents the three larger category. So here we're talking about 10%, if I'm calculating correctly. Well, yes, except that could we go faster? Another good news that we got this morning, if CNG is delivered to us next week, that's a vaccine that would receive 60-some thousand doses next week, an extra. Well, of course, that could accelerate the fact that it is only a one-dose vaccine. Are we going to take it to pharmacies? What are we going to do? Because it's not an RNA. So anyway, it's at least 10%. And depending on what will happen, how can we work with the second dose? Could we delay, when we go back to a normal life as described by the federal public health? Well, on going back to normal, I think that I understand you're trying to answer the question in a different way, but it's a very, very nice way of doing it. Yes, thank you. Well, anyway, we'll get back to, as I answered to Ms. Côté, we'll get back to you over the next few days. To get back to what vaccinated people can or cannot do, many people are asking themselves, well, as of the moment, the third try, is this the third try on the same question? Yes, we're going to keep trying. Normality. People who are vaccinated are wondering, well, when we get vaccinated, it's been 3 weeks, what prevents 3 or 4 vaccinated people from getting together? What are the real risks? Are there any risks if people meet 3 or 4 and they've all been vaccinated for a few weeks? What has to be understood is that vaccination, to get its full potential, requires 2 doses. That does not mean that 1 dose does not protect you against complications and things of that nature. But immunity is not yet sufficiently high in the public for us to be able to allow for those approaches. It's coming. I don't want people to think that we're vaccinating and that the vaccine is not giving us any hope. It's coming. And it will come with a greater proportion of vaccinated people, which will decrease the risk that anybody be carrier of the virus but transmit it to somebody else, which is of concern, and it will come depending on the epidemiology that we'll be observing, how things will go. And it's going to depend also on the context, whether there's no new variant introduced. That also has to be taken into the equation. You know, I learned in 2020 that every time I tried giving a number, I learned my lesson. So you're not going to get me with the numbers this time. It's scenarios. It's an analysis that takes all of these in consideration, but the epidemiology, what happens, the age groups that are reached and all that, what the hospitalization rates, are there still people in intensive care, are they young people? All of those things we look at together to be able to get to the magical recipe for to end the lockdown. And also, I want to say, you know, all sorts of work is being done. The CDC just published things about restaurants, but we have to reach a certain level of vaccination. And that is why I would ask Quebecers to go get vaccinated as quickly as possible, because that is how we'll be able to, you know, have an important mass of people vaccinated with the first dose and a series of second dose that will be able to get to more normalcy, because then the probability of vaccination failure is going to be much lower, because there's going to be a lot of people vaccinated, and that's very important. Mr. Dubé, you talked about an adherence rate problem. The drama that we just learned today is not going to reassure a lot of people who already have fears with this vaccination. We're trying to make them go get vaccinated, but we understand that it sends quite the shock. Maybe it's not the right message. So what will you say to those people? You know, go anyway despite your worries? Well, that's what we've been saying since the beginning. It has to be understood that there is a risk. There's always been a risk, but we said it, that risk of collateral effect, 1 for 100,000, and we've confirmed, we vaccinated up until now 2.8 million of first doses, a little over 2.8 million of first doses, and it's the first severe cases. The 3 other cases are being followed because we are in a hyper vigilance, and we can have an appropriate treatment for those who have complications. So I think that if we look at all the benefits, and I know that that is what we answer, but when we look at all the benefits of vaccination, look at the number of deaths that has lowered, look at the number of hospitalizations and how we've taken control in our CHSLDs thanks to vaccination. So I think that the equation is very easy to make. But unfortunately, these cases happen. I think people will still continue getting vaccinated, but I think that we've always said that we had to understand the risk that we're taking, and that risk, we can unfortunately see it every once in a while. It has a face. Otherwise, there are effects that are beneficial, and I think that we have to continue vaccinating. Now, what I said on those people in the 2 categories, and I'd like to repeat it because the appointments disappeared very quickly in the other categories, and I just want to make sure, and that's why I'd like to remind that of people today, that people who are having a harder time making appointments, I'll give you an example. Yesterday, I spoke with the Federation of general practitioners, and I talked to Dr. Godin, and I asked him to send a message to all general practitioners to call up their clients and to invite them to go get vaccinated, because there are perhaps clients that haven't thought about picking up the phone, or perhaps, that they should have their doctor accompany them, either because they have chronic diseases or regardless. So we are in a category that is perhaps more difficult to go get right now. So I think that is why I like to give them a few more days for those people to be able to make appointments, and after that we'll open it up to the population at large. You mentioned that there are 3 other cases of thrombosis that you're keeping an eye on? Yes, so they're being examined by public health. All right, so 7 journalists have asked their questions. There's 14 questions in fewer than 14 minutes. Let's continue. Details about the people under observation. You said people who were vaccinated with the vaccine of AstraZeneca. So there's 4 people under observation. There's probably been 2 cases that are confirmed. Unfortunately, the case that I just announced of the person who died, another person who had thrombosis but who had treatment and who is recovering, and the other 2 people as well for whom we're waiting for confirmation, who would have had allegedly had, but we have to have a confirmation test to know whether it's associated to the vaccination or not, and it comes from Hamilton, to know that it really is, and not a concomitant thrombosis that sometimes happens. It's happened that people get vaccinated, they have the thrombosis, but it wasn't associated to that. Now, the Johnson & Johnson vaccine, Dr. Arruda, should we understand that the rules are going to be the same that in the case of AstraZeneca, that it's always also going to be for 45 and over? We're waiting for the CIQ to give us their notice on that. It's a possibility, taking into account that we've also talked about thromboembolic events associated to that. Well, you have to look at more specific data because there are some. Is it in the same age groups? What is it exactly? But we're waiting for their advice, and it'll come before we have vaccination available in Quebec. You talked about Johnson & Johnson. What will that change concretely on the vaccination strategy in Quebec? The arrival of these new vaccination, because it's 1 dose only. Any new vaccination is welcome, but I think that the number right now is not very important. We're talking a little bit over 60,000, whereas you know that we vaccinate over nearly 500,000 per week. So yes, but I would prefer to wait and have the opinion of the CIQ, because it would help us out with pharmacies. So I prefer waiting for a little bit, but it will not change. It will not change our timeline. Right now, to get vaccinated, if you're a teacher, there's no verification being made. Same thing for people with chronic illnesses. Do you have any idea of the people who are going over the rules right now and go get vaccinated instead of teachers or people with chronic illnesses? I would tell you that we would not have an investigation. So, of course, after a week, we started at last Thursday for 2 categories. Of course, we're going to talk about it with our CEOs. I talk about it with them very regularly, but I don't think it's an issue right now, especially since it's not like we don't have enough appointments right now. Mr. Dubé, in Saguenay-Lac-Saint-Jean, could we go regionally and modulate it to go faster with age groups? Well, it's another way of asking the same question. I think that we are going to have a look when we get looking at your predecessors, but I think that we're going to give you an answer over the next few days as far as, when we'll have finished our 2 first categories. The 25th of February, we're talking about a vaccination passport. We're talking about the sequence of elements that were coming. Is that still in the works? Well, I want to really be careful with my words because it put me in trouble, so I want to be very clear. And I think you're the one who had asked the first question, so I remember that quite well. I've always talked about a vaccination proof. That is what we want to have. That is a digital evidence that we have been vaccinated. I talked about that again with my assistant minister this morning. I promised that there's going to be a presentation on Friday, and I will give you more detail with this next week. English question now.
Good afternoon to the 3 of you. The news of this death with regards to the vaccination campaign What do you think this does to the province's vaccine efforts?
Well, if I may on this one, I think this is sad because, I mean, every death we have experienced a number of deaths in the last year, so this is not the first one, and this is very sad. But I don't think it changed the program at all. In fact, we were expecting to have those complications with a certain number. It is within the number of person that could be affected. We are in that number. That's very unfortunate, and we are sad about it. But that's the price of vaccination.
If there's someone out there, or maybe a group of people out there who are saying, "That's it, I'm not getting the vaccine," what would you say to them?
Well, I think those people were there before. And I think that people, as we said, I think we've been very clear where we announced that we have this option for the 55 and below, that we had this option with AstraZeneca. And those risks are also with the other vaccine. It's not only with AstraZeneca. And we said to our people that just be aware that there is that probability. And so far, within 400,000 of AstraZeneca, we have less than 4 cases. So we are within those numbers. So it's really unfortunate, and we need to be very clear about that. But I think that's the price to pay to be vaccinated and to be going back to a normal life at one point in time.
Katsuni, CBC.
Well, have a good day, everyone. Just going back to this question, I remember a few weeks ago, AstraZeneca was good only for 55 years old and up. And then Quebec reduced the age for 45 years old. Humanly, Mr. Arruda, do you have a certain part of regret with this first step?
What I regret is the story of this woman, because I think if we could have prevented, if we knew that she was going to do it, we would not give her the vaccine, but it's impossible. But I don't regret, because we are sure we are preventing more deaths and more complications of the disease, even with that vaccine. It's really this one. And when we did the first 55 years old and older, it was the first signal. And it was temporary, and we want to have more data. We went to 45 here in Quebec based on our epidemiology. Other provinces are going down to 30 because they got so much cases that the risk-benefit is better with the vaccine. So what I can regret is that if I should know she was the one who would have the reaction, but it's impossible. So the only thing I can say is that we knew that, and it's not 1 under 100 cases. This is for embolism. It's not you die from, because there is a lot of people who will be treated the right way, and they will have no sequela from this. So but anyone who dies makes me feel bad, even from the vaccine, or which is very rare, comparing to a case of COVID-19.
Premier Legault, we have this death today, but if you look at what's going on in Quebec, and if you compared the situation of the province with Alberta, Nova Scotia, or Ontario, like the army is going there in Ontario and Nova Scotia as we speak. What do you think is working in Quebec right now?
Since many weeks, we had tougher measures in total. Regarding schools, regarding retail, regarding, of course, the curfew. So we had put in place more measures. So I think it's related to these measures. So I'm happy to see that we're doing better for this third wave.
Nous allons maintenant donner la parole à Raquel Fletcher, Global.
Good afternoon. Can you hear me okay?
Yes.
My first question is the decree requiring healthcare workers in contact with patients helping to move up vaccination rates among healthcare workers? And are you satisfied with their vaccination rate? And will you extend it to private CHSLDs?
To the first question, I'm not satisfied yet because I would be more satisfied when we approach the 80-85%, and we are currently at roughly 67%. There has been quite an improvement over the last 2 weeks since we put that measure in place, vaccination versus testing. So I will be pleased when we get above 80%. And the second point to your question, we will do the same measure in the private CHSLE over the next few weeks.
Thank you. My second question is there have been problems getting test results from the Kirkland Testing Center. What is being done about that?
I think there is a slowdown in the what we call the 3L, Laurentides, Laval, and Lanaudière. And we will do the same analysis as we did in Outaouais. I think there was a matter of equipment, but again, we are on the case right now, and I think we should see an improvement in the next few days in those three regions.
Philippe Autier, De Gazette. Good day. The vaccination process is unfolding quite well, and there are people in CHSLDs and seniors' residences waiting for their second dose. Given that it's going well, do you anticipate moving up the date where they will all have their second dose? I think you said, Mr. Dubé, that it was May 9th.
Yeah.
Is there any way with the doses coming in that you can move that up?
I would like to, but the issue is with Moderna. Moderna is supposed to arrive late in the, I think around the 28th or 29th. Daniel Paris should confirm that. So depending on when we receive Moderna, I could accelerate, but we're a little bit dependent on the date we receive Moderna. That's the reason we gave ourselves a bit of lead time to be on the 8th or 9th, but we will respect our 112 days, that's for sure. And it's going well right now.
Dernière question, Monsieur Autier. Mr. Legault, you were talking earlier that we might have a better summer, this one, than the last one, of course. What's your prognosis on how the summer will be? Will there be, you say better, but does that mean festivals in Montreal? How cast your mind forward?
I just said that it will be better than last summer because of the vaccination. So, of course, we are asking public health to give us more details. You cannot imagine the number of people having organization of festivals or whatsoever that are talking to me, asking me, what do you think about the summer? So unfortunately, I don't have the answer now, but I hope to have it very soon because I've asked for a plan.
Merci à toutes et à tous. Bon après-midi.
Thank you, everyone, and have a good afternoon.